small school, and this will just be a small taster for people on, not Facebook, YouTube. Okay, I don't know if this is going to work. Let's see. You might see something on your screen saying that you are live, something like this. Okay. All right, let's get started. 3, 2, 1, go. Okay, so this is OET writing. We're focusing on the passive. Okay, so yesterday we did an introduction to the passive. Most people know what the passive is, though. Okay, today we're going to go a little bit deeper and look at some of the big problems, or one of the biggest problems students have with using the passive. One of them is direct and indirect objects. So in this class, guys, what we're going to do is we're going to do 3 things. All right. First thing we'll do is just quickly review yesterday. Second thing we'll do is we'll look at direct and indirect objects. Oops, someone's trying to get in. Direct and indirect. Last thing we'll do is we'll talk about something. We're going to talk about verbs. There are 2 types. We call them monotransitive and ditransitive. It doesn't really matter what we call them, but they're important. It's important to understand what they are. Okay, so let's get started. Review. Esma, can you tell me what is passive, please? Give me an example of passive.
While we are using the passives, we focus the object. Also, it changed our.
Okay, so she has a bad connection here, but she says we use passive to focus on the object of the sentence. Is that right, everyone?
And additionally,
she has a bad connection, so maybe Esma, you can.
Yeah.
Oh, that's okay, guys. Is this right? We use passive to focus on object of sentence. Yes.
Yes.
Or no?
Yes.
Yeah, we use passive. She's right. We use passive to focus on the object of a sentence. Also, to be more formal, to be more professional sounding, or for example, if we don't know who the subject is. But in OET, really the key idea in OET is that we want to focus on the object of the sentence. So for example, if we say the doctor treated the patient, okay, Kadriye, there's 2 problems here, Kadriye. What's the mistake with this?
Yeah, here is we focus the doctor, but OET is not allowed like that because we should focus the patient.
So the patient is the object of the sentence.
Yeah.
Does everyone agree here? The patient is the object of this sentence.
Yes.
Yes. The subject, verb, object. Okay. So in passive, we want to shift the focus to the patient. In this example, just this example. So Kadriye, can you give me the passive of this?
Yeah, the patient was treated by the doctor.
Okay. Now, is this correct?
Yeah.
Yes.
Yeah.
Well, there's 2 problems actually here. So this is correct now. This is passive because the object of the sentence, right? The object is now at the start. But in OET, do we say the patient, everyone?
No.
We never say that. What do we say, Kadriye?
Mrs. Brown, for example.
Oh, Mrs. Green. Yeah, Mrs. Brown. Okay, so we always use the patient name. We never say the patient in OET. Simiat, can you say hello?
Yes, hello.
In OET, do I say by the doctor?
No.
Why not?
We are just concerned about the treatment, not who is rendering the treatment.
We're focusing on this and this, right?
Yes.
Guys, when you use passive, you can focus on the object of the sentence, actually, or the verb. You can focus on the verb as well. Okay, so you guys are nurses or doctors or physiotherapists or whatever. You're not focused on yourself. Everything is about the patient and making the patient better, well again. Okay, so this is what we talked about yesterday. We talked about the passive as the focus of changing the focus of a sentence. I also talked about something else. Mizgin, can you remember what the other thing was that we talked about yesterday? Another thing. Do you remember this?
Can you give me clue? I can't
Oh,
remember.
do you remember this from yesterday, Mizgin?
Yes,
Actions of what is this?
first one, we should focus on action of patient.
That's not quite right. Focus on the action of the patient. So are you saying that I should put this sentence into passive?
No, it is active
Okay, tell me why.
because we our letter also mentioned about patient. The patient action should be active.
Okay. Guys, this should be the active voice, but she's not really explaining it. I'm not sure if she knows. Put your hand up. Why should this one be active? It's really simple. We already said. Esma, why should actions of the patient...
Because Mrs. Green visited our clinic by herself.
Where is the focus of this sentence, guys? Is it on the doctor or on the patient?
No, Mrs. Green, our patient.
Focus is
On the patient.
Our
on the
patient.
So do we need to change to passive?
No.
No,
No, it's active, yeah.
we already have the focus on the patient because the patient is the first word. Everything is about which is the first word. Okay. So in actions of patient, we want the focus to be on the patient, so we use active. In actions of the medical professional, Lee, Simiat, Mizgin, Hina, is it active or passive here?
Passive.
It's
Passive.
why is that?
Yeah, because Green was treated, so it didn't mention the person that treated her. We're just concerned about the patient and the treatment.
Good answer. We're just concerned about the patient. Again, this is the focus, right? The focus of the sentence is also Mrs. Green. But Kadriye, did Mrs. Green do the treatment?
No.
The doctor did the treatment, right?
Yeah.
So
Mrs.
the
Green, receiver, Dr. Doer.
Exactly. So this idea, I think, of focusing on the patient is important in OET. I'm not saying that we always use passive to focus on the object, but in OET we do, because the object is usually the patient. Okay. When the object is not the patient, we would use the active. Here, the object is clinic. So we do not use passive. Okay, what about actions of body though? Ina, any ideas on this one? If I say his blood pressure, you were not here yesterday. Aishat, if I say his blood pressure, Anastasia,
Hello.
right? In this sentence, this is the subject, right? Here's the subject and here is the verb. Who is doing this action, guys? Who is doing this action?
It is not clear.
I know what you mean, but what did I say yesterday, guys?
It might be as a result of drug or medication the patient takes.
It might be, but we are talking about the actions of the
Body.
body. Okay. Now, you're right. It could be that the drug is doing this. I think that's a very good point. We talked about that yesterday. Okay. But guys, usually in OET, this is an OET class, am I using active or passive?
I
Active.
think in this case we can use
We
both.
use passive.
Not passive. Who said that? No. Passive would be like this, was increased. Okay. This is going to be active. So I said this yesterday. Actions of the body. For example, his arm was hurt or his arm hurts. Which one? Everyone.
His arm hurts.
Usually it's this one. Not always, not 100%, but usually we're using the active voice. Okay. This one is complicated. It can be both. Okay. But usually in the exam that you will do, 90% of the time it will be active. His blood pressure increased. His heart rate increased. You don't normally say was increased, okay? When we talk about the levels that you have, blood pressure, respiration, things like this, okay? It's usually in the active voice. Okay, so this is a review of yesterday. Yesterday we talked about what is passive, and we also talked about OET. This is in OET. In OET, the actions of the patient are usually active. The actions of the medical professionals are passive, and the actions of the body are active. Okay, now, today I want to go a bit deeper. Today I want to talk about this problem. Can I show you guys a problem?
Of course.
Okay, so yesterday you were writing sentences in passive. All of you here, you were writing sentences in passive. Kadriye even changing all the tenses quite easily. Okay, so I know that you guys can write passive sentences. But today, sometimes we get a sentence like this. I want someone to read this sentence. Maybe Esma, or we could try Anastasia. Can you read this?
The doctor prescribed antibiotics for Mrs. Jones.
Okay. So is this active or passive? Dinesha, Gloria, is this active or passive?
Active.
Active.
This is active, right?
Yeah, active.
And Ismail, should it be active
No.
in OET?
Right.
No, it should be in passive form.
Passive.
Because this is the actions of a medical
Somebody.
professional, right?
Yeah.
Everyone, is the doctor a medical professional? Yes.
Yeah.
Yes.
Yeah.
Yes.
Is he
Yes.
is he doing the action?
Yeah.
Yeah.
So this is wrong, right? We don't put this in the active voice. We need to make a passive, okay? So remember, subject, verb. Where is the object here? Maura, Mercy, Minon. Where is the object?
Mr. Jones.
Mr. Jones.
Mr. Jones.
Mr. Jones.
Antibiotics.
Yeah.
Antibiotics, yes.
So Omar, are there two objects here?
Yes.
What do we think, guys? Is there two objects here?
I'm not sure.
Yes, two objects.
Yes. Yes.
Yes, there are two objects.
Yeah, we have two objects.
And we said, remember, passive, we start with the object, right? We have to start the sentence with the object. So which object do we start with? Do we start with this one? Or do we start with this one? Kadriya, which one do we start? Just Kadriya, which one? This is the problem. Which
Yes,
one?
actually, we can use both of them, I think, because, yeah, antibiotics was prescribed for Mr. Jones, or Mr. Jones was prescribed antibiotics. We can say both of them.
Okay, is she right, guys? Does everyone agree that we can say both here?
Yeah.
Yeah.
Yes.
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 Okay, so we can say, for example, we can take the object of antibiotics and we can say, one more time, could you say it again? Antibiotics?
Yeah, antibiotics was prescribed
Was
for
prescribed, yeah.
Mr.
Antibiotics
Jones.
Just
were prescribed.
Just Kadriye, please. Antibiotics was prescribed. Kadriye?
For Mr. Jones,
Okay.
By the doctor.
or
Wait a second. Firstly, it's just Kadriye. No one else is speaking.
Okay, sorry.
Now, he said by the doctor, Kadriye. Should I say by the doctor?
I think it's not needed. Yeah, because of it's not our focus.
We don't.
We know the healthcare profession.
And it's just the wrong style. We don't, in the letter, in your OET letter, you don't need to say the, and you shouldn't say really the subject of the sentence. Okay, so antibiotics was prescribed. We can say this one, okay? But we can also say, Kadriye, the other one as well. What's the other one? Mr. Jones?
Mr. Jones was prescribed antibiotics.
Okay, so Mr. Jones was prescribed antibiotics. So does everyone see that in the first one we're using an object, in the second one we're using another object? Does everyone see this?
Yes, Aaron.
Okay. What are they called? Lee, Mizgin, Ilkner. Can you say hello? Hina,
Hello.
Mizgin.
Yes.
What is the name of this one? Do you know the name of the antibiotics?
I think it is a direct object, and
Is she right, guys? Is this one called the direct object?
Yes.
Everyone, is this one called direct object?
Yes.
Yes. Kadria, why is it called the direct object?
I think because it's important word, antibiotics is our focus and the patient also. That's why we can use both of them.
It's not just because it's important. Why do we call it the direct object? Anyone know this? Esma, Oiku, Ismail? Why do we call it the direct? What is this one called? Everyone, this one is called
indirect.
Indirect object.
indirect. So what is the difference? Dinesha, Anastasia, can you say hello?
It is a prescribed antibiotic, so that is why it's direct object.
So can you explain a bit more?
Action is prescribed antibiotic, so that is why it's called direct object.
So this action is going to this one. Yeah?
Yeah.
So we can say, how about this? Receives the action. Does that make sense, everyone?
Yeah, Mr.
Yeah.
Jones received the action.
So to receive the action, what does that mean? Amara, Aisha, what does receives action mean? What does receives mean? Everyone, receive means to what? To receive?
Take.
To take. Well, maybe take a little bit, but guys, to receive something is to
Get.
get.
To get.
Yeah. To obtain it, right? It comes to you. It comes to you. Okay. So this is the idea of the direct object. It receives the action. I think we all understand this, but what is an indirect object then? Fumi, could you explain to us what an indirect object is? It's hard.
Hello. Yeah.
Hello, Fumi. What is an indirect object?
Indirect object is antibiotics.
It's Mr.
That is the direct object. So the doctor.
You're not sure. It's okay, Fumi. You're not sure.
Not sure. Sorry.
Okay, let me ask you a question, Fumi. Who benefits from the antibiotics? Who is
Mr. Jones.
Okay, so guys, we can just say the indirect object is benefiting. What does benefits mean, guys? Benefits from. Anyone? What does benefit from mean?
Gaining.
Gain. Anyone else? What does benefit from mean? Benefit.
Advantage.
Advantage. Okay. So this is, I think, the best way to think about it. You have a direct object which receives the action. It's the first thing. Okay. The other thing is called the indirect object, and it's benefiting from it. So for example, guys, if I say Alan threw the ball to Kadriye, what is the direct object in that sentence? Alan threw the ball to Kadriye. What is the direct object? Alan threw the ball to Kadriye. Everyone, one more time.
The ball.
The ball.
Who benefits?
Direct.
Exactly. Who benefits from the ball now? Who has?
Kadriye.
Kadriye. Okay. What about this? Alan booked some concert tickets, I hope this is right, for Esma. Okay, so where is the direct object here, guys?
Concert tickets.
Concert tickets.
And who will benefit from those tickets?
Esma.
So this is the idea here, okay, that you have a direct and an indirect object. The problem we have is, in this case, can we use both direct? Can we always, this is the question, can we always start with the indirect object? Which one is the indirect object here? Which sentence is the indirect object?
Is that just
The one that starts with
Second
D
one.
is
Prescribed
second
antibiotic.
one.
Now, here's my question. Can we always do this?
No.
According to
No.
OET, yes.
No way. No way.
No.
Let me give you an example. Okay. I'll give you an example. Alan gave the pizza to Kadriye. Is this correct, Kadriye?
Yeah.
Okay, and is this active or passive?
Active.
Okay, so what's the passive of this? I could say the pizza
The
Was
piece
given
was given to
Kadri.
Kadri.
Is it correct, everyone?
Yes.
Yeah, this one's okay. Can I say Kadriye was given the pizza? Does it sound right?
No.
No.
No,
No.
it's fine. It's fine. Of course you can say this.
Yeah, we can write.
Okay. What if I change the verb to eats, though? Alan eats the pizza for Kadriye. So now you cannot eat it, Kadriye, but I am eating it for you. I am enjoying it for you. Okay.
Interesting.
Now, can I say the pizza was eaten for Kadriye? Like I am doing it for her. Yeah.
Yes, yes, makes sense.
But can I say Kadriye was eaten?
No,
No.
No,
it's
right?
not possible.
No.
And this is what we're going to be learning today. Some verbs allow two objects, allow you to start with both of them. Some verbs like eats, you cannot say Kadriye was eaten because this, what does this mean, Kadriye? This means Alan is eating, am I eating a pizza or am I eating you?
Yeah, me.
I'm actually eating a human being.
Interesting.
I am now a cannibal. Okay, so
Adrienne.
this is the problem. I'm just giving you an example. We'll learn more about this later. Okay, so the answer is no. We cannot always start with the indirect object. Okay, in this class, I'll teach you. It's very easy to understand which one you can use and why. Okay, but I have two here. I have this one and I also have this one. Okay. What is the difference, Esma, between this sentence and this sentence? Any ideas what the difference
First
is?
sentence is passive. Sorry, active. Both of them same, I think.
Both of them are active. Okay.
Yes.
What preposition am I using, guys? Everyone.
To.
First for,
Yeah.
second one is to.
Yeah, we can use both of them.
Yes.
So, guys, when we talk about direct and indirect objects, we're always going to use, almost always, for or
To.
So when you see for or to, you know this is direct and indirect objects. Is that clear, guys?
Yes.
This is very important. Does everyone understand my point here?
No.
Yes.
No.
Okay, let me give you an example. If someone doesn't understand, that's great. Let me give you an example. I can say, I gave the book to Esma. Is this direct and indirect objects? These
Book
two.
direct. Esma
Yeah.
indirect.
right? Because we're using to, all right? What if I said, guys, I put the book on the table? Is this direct and indirect objects? No.
Book on the table. Cool.
Because we're using on. Does that make sense, everyone?
Yeah.
Everything I am saying today is for to or for, like this. I'm not talking about on or in, other prepositions. Everything is for these prepositions. Okay, does that make sense, guys? Only for, only to. It is possible to do it with other prepositions, but it's very, very, very difficult. Stay only with to and for. Okay, my advice, only use to and for direct and indirect objects. 99% of sentences will be like this. Okay, all right. What about to then? Let's look at to. Where is the direct object in this sentence? The nurse suggested lifestyle changes to him. Hina, can you say hello? Just Hina or Demola. We're repeating the same ideas now, so it should be easy. Hina, can you say hello? Yep. Mercy. Hello, Hina. So where's the subject of the sentence here? The nurse suggested life changes to him.
The nurse.
The nurse.
Okay, where's the verb?
Suggested.
Suggested.
Okay, and Demola, where's the object?
To him.
Well, there's two. There's changes and there is him. Okay, and Demola, we can say him or we can say to Mr. Jones, right? It's the same. Okay, so Hina, can you make me a passive with this one? Mr. Jones, can you make a passive?
Mr. Jones was suggested lifestyle changes by the nurse.
Mr. Jones was, so is this correct, everyone? Correct? Correct or incorrect?
It's correct.
Not quite. There's a small mistake.
Yes, it's interesting.
Mr. Jones was suggested change
Lifestyle changes was
Lifestyle.
Lifestyle changes was suggested for Mr. Jones.
This is fine. Do we say by the nurse?
No.
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 Kadriye, is this the direct or the indirect object?
Indirect.
The indirect object we're starting with. Okay. Why is it the indirect object? What is the reason for being
It benefits from lifestyle changes.
Yeah, Mr. Jones benefits from changing his lifestyle. Makes sense, everyone? This is actually something that I got from Paul. This is a nice way that Paul teaches direct and indirect objects. Okay, so we can think about it benefits from, advantages from. Okay, give me one with Hina. Can you give me, or Anastasia, give me a sentence starting with the direct object now. So lifestyle changes. Can you give me a passive? Anastasia, normally you're quite fast. Simiat, lifestyle changes. This is hard. Shaki.
Was suggested.
I think it can be lifestyle changes was suggested for Mr. Jones.
Was suggested.
Simiat, is it was? Shakeen, was?
Yeah.
Were.
Were. Actually, you have to change the another one. Antibiotics were prescribed for Mr. Jones.
No, you can say lifestyle changes were suggested. It's okay. Esma, is this the direct or the indirect object?
Direct object.
Is she right, guys? Is this the direct object?
Yes.
Yes.
Yes, that's the direct
object. Okay. And Mr. Jones is the indirect object. Okay. Does anyone have any questions? Is this making sense to everyone? Put your hand up if you want to ask me a question. Esma, go on. Go on, Esma. Okay. She often does this. She puts her hands up so she can't speak.
Yeah, Alan.
Gloria, go on.
Yeah, so if you see the other one, it said Mr. Jones was prescribed antibiotics, but for the two, I don't understand why we couldn't use was, but this time around we are using were.
No. It's complicated. It's because sometimes we think about antibiotics, we say the plural, but we think it has singular. Does that make sense? But actually, it's wrong. It should be were. You are correct. Is my mistake. Okay, so antibiotics were because it's plural. Okay.
Yeah, my mistake, yeah.
It's just very often native speakers. My mother makes this mistake all the time. She talks about antibiotics, but she means only one. It's just it doesn't
Yeah.
matter. But you are correct.
Depends on the situation.
Okay,
Again,
so Alan,
go on, Gloria.
we are using were. So lifestyle changes were suggested. So assuming it was lifestyle change, no, it can't be possible. So we are using were because the changes come with S, right?
Yes, exactly.
Okay, thank you.
So if we have the noun here with S, oops, you will need to change the verb, the be verb, to plural. Okay, it's a good question. Now, I'm going to ask you guys again. Can we always start with the indirect object with to? Here, yes. Here it's correct, but can we always do it?
No.
Guys, here it is correct.
No.
But we cannot always do it. Okay? It's the same here as well. Sometimes yes, sometimes no. The reason is all about the verb. I'll teach you later. Everything is about the verb. Can the verb be applied to both the direct and the indirect object? Okay.
Can I give an example, Ella?
Yeah. Well,
For example,
save it for later because I'm just looking for time.
Sorry.
But literally, you come back and give the example. Now, guys, this is what we're going to try to practice. Okay. Firstly, just making the changes. So changing to passive from the direct and the indirect object, we will practice now. But then we will also be thinking about, can we always do this? Okay. So I have some exercises. Is everyone ready to do some practice exercises?
Yes, Helen.
Okay, so Esma, you help me with this.
Of course.
Okay, so we have some case notes, guys. These are my case notes.
Mm-hmm.
Very simple. What's the name of the patient, Esma?
Mr. Lee.
And how old is he?
56 years old.
Okay. Now, we're going to focus on, we could do this one, okay? So instructions not explained to him. Now, in the active voice, guys, we can make a sentence like this. Doctor did not explain
instructions to him.
Okay. Now, is this correct, everyone? Should we be making a sentence like this?
Mm-hmm.
No.
No.
Why is it wrong?
Because
looks like informal.
You don't need to focus the doctor.
The actions of medical professionals should always be in passive. Make sense? So,
yes.
Who is doing the action? The doctor.
Doctors.
Okay. So that means we need to change to passive. Now, we have the problem here that we have object and object, right? So this is let's do this slowly together. Hina, can you say hello?
Hello.
Can you make a sentence starting with the direct object, please? Can you try?
Instructions were not explained to him.
Is this correct, guys?
Yes.
Yes.
Okay, now everyone, let's try and make a sentence now starting with the indirect object. Okay, I want you all to type in the chat box. He. Right, we're starting now with the indirect object. Can you finish that sentence in the chat? The indirect object in the chat. No need to speak or put your microphone on. In the Zoom chat. He, what's next? I'm going to make a passive. I'll check your writing. Also think, is it correct? Does it sound right? Shakeen, you cannot use didn't, okay? It's very informal, Shakeen. Didn't. You never put that in the writing. Contractions.
Yeah, I just made the correction.
Okay, so he did not get an explanation. It's not the, it's a different types of passive. I want you to use be verb, Shakeen. Normal passive, not that one. Esma, he was not explained the instructions. Nice, Esma. Correct. Andrea, the instructions were not explained to him. That's the, he was, yeah, Andrea, correct. Shakeen, try again.
Okay.
If you use do, it's not passive, guys. If you say he did not, it's not passive. We have to say he was not. Passive, remember? Passive is be. Passive is this. Object plus be verb plus verb 3. Past participle. So Lee, try again, please. Hina, he was not explaining the instructions. Good. He, correct, Hina. Ismail. Correct. Ilknur. Correct. Dinesh. Correct. Okay. Ina, he was not. Okay.
But how I can tell not by doctor? He wasn't explain instruction and explain by doctor. I can't use by doctor, yes?
Yeah, we don't normally talk about ourselves in our letters, yeah? So we don't say by the doctor. It's the style.
Yeah, I know.
Yeah?
So
It's not,
instead of doctor, just don't write at all, yeah?
yeah, it's the style is bad style. You don't say by the doctor. Never. You just say like this.
Like this, okay.
It's really easy. Now, and Anahita, he was explained with the instructions. Anahita, can you say hello? Anahita.
Hello, Helen. Hello.
Remember, Anahita, it's 4 or 2. But you wrote with.
Okay. Yeah.
With, it's 4 or 2.
Oh, okay. Yeah.
No, with. Okay, so try again. Try again.
Okay. Yeah.
Not explained with. Shakeen, same. Shakeen, can you say hello? Look, 4 or 2. It's not with, Shakeen, right? Look, did I say with? No. In fact,
No.
it's specifically
He
only.
was not explained.
Yeah, this is really important, guys. Everything I am saying today is for 2 or 4. Not with, not on. These rules will not work with other prepositions. You'll make mistakes. Okay. All right. Now, I'm going to ask Ismail. Can you say hello?
Hello.
So can you make a sentence using the indirect object? He
was prescribed medicine.
No, this sentence here.
Ah, okay. He was not explained the instruction.
Good, good. So he was not explained the instructions. Okay, now here's where it becomes more difficult now, guys. Okay. Is this correct? Is this one correct?
No.
No,
No, it's not.
this verb explain, this verb, it's not like prescribe.
Yeah.
Prescribe, you can do both. But explain, it doesn't, this sounds very, it just sounds very, it sounds informal.
Like it's.
Yeah, it sounds a little bit incorrect. It's not really bad, but it sounds wrong.
Weird. Yeah.
This case, guys, you have to remember that explained doesn't really take the indirect object. Okay? That makes sense, everyone?
Yes, just like the it.
And you just have to memorize some of these. I have a list of things you can study later. Okay? The reason is that it just doesn't work. These two words don't work together. Okay. Can I show you some more case notes now, guys? Is everyone ready?
Yes, Helen.
Yeah.
This time we have Mrs. Grant, so a woman. Okay. She's 42. Diet plan suggested, no follow-up appointment given, diet changes not monitored. Now, can you give me the active, Kadriye? We could say the doctor. This is the active.
The doctor suggested a diet plan for Mrs. Grant.
It can be for or it can be
Or
to.
two, yeah, two.
He is both, actually.
Mhm.
And to Mrs.
Grant.
Grant. You say Ms. Say it like this, Ms.
As okay.
Okay, so guys, this is the active. I want you all to go and change to passive. Give me one sentence with the direct object and one sentence with the indirect object. Okay, go to the chat and write me a sentence in the passive. One sentence starting with the direct object, one sentence starting with the indirect object. I'll check your work, okay? Yes, so was suggested. So Kadriye, that's one. Now do the indirect one.
It will not correct, but I can try.
I think suggested is allowed. I think it's okay. And this is
okay.
what I have a diagram later you can study, guys. Some verbs yes, some verbs no. Sometimes it's very difficult to see, Kadriye, but sometimes it's very easy, like with eat.
Yeah.
You cannot use two objects with eat. You cannot start with the indirect object. Aisha, a diet plan was suggested to Mrs. Grant. Yeah, good. So everyone very nice with the Simiat. Very nice. Hina. Good. Omar, good. Shakeen. Mr. Grant was suggested a diet plan. Yeah, Shakeen, really fast. Very nice. So Shakeen, can we do both? We can do both, right? Does it sound right? Both of them. The answer is yes. This one is okay, guys. Okay, you can do both. So explain no. Suggest yes. Aisha looks good. Gloria good. Dinesh good. Dinesh. Maybe don't use all capitals. A diet plan was suggested to Mr. Grant. She was suggested. Yeah, there we go. Ismail. Lee. Nice, guys. Nice one. Nice one. Keep going. I'll give you 30 more seconds. Good. And we'll continue doing this tomorrow because there's a few extra things we need to mention. Okay, good. Everyone stop. Everyone stop. Demola, can you say hello? Demola.
Hello.
So Demola, can you give me the sentence with the direct object, please?
With Mrs. Grant, right?
The direct object is receiving the action.
Yeah. Mrs. Grant was suggested a diet.
A diet plan. Okay.
A diet plan.
Is this the direct object, everyone?
No.
No,
That's indirect.
no, it's indirect.
Indirect. So Demola, remember, indirect is the one who benefits from it.
Okay.
Demola is usually a person. Usually. Not always, but usually you can see it's a person, a name. Okay. The direct object is the diet plan. So Hina, can you give me a sentence starting with the direct object? A diet plan
was suggested to Miss Grant.
Is this correct, everyone?
Yes.
So it should be Ms.
Ms. Yeah.
Yes, exactly.
Now, maybe I'll show you this tomorrow. Yeah, I'll show you that tomorrow. Okay, so I think we're doing well. This verb, you can have both. Okay. So what do we call it when a verb allows both? When a verb allows both, what do we call it? Both direct. I'm sure not many people will know, but maybe you guys are studying grammar. I don't know. Adria?
I'm not sure.
Okay, guys, it is called ditransitive verbs. Okay, it doesn't matter what we call it. This just means two. What does die mean?
Die is two.
Both of
So think about it as let's change it. Let's just call it two object verbs. Okay, ditransitive. So we have two object verbs, ditransitive, and we have one object verbs. This is called monotransitive. Okay. Does this make sense, everyone?
Yeah.
Now, is suggest ditransitive or monotransitive?
Ditransitive.
Is die.
Usually, maybe even this one sounds a bit better, but this is okay. You can do both and it sounds all right. Sometimes one sounds a little bit more natural, but these are both correct, I think. Monotransitive, I think we can probably say is here. Explained. Okay.
Yeah.
You can say this actually, but it sounds quite informal. It doesn't sound correct in an OET letter. Okay. So this would be an example like this. All right. Now, I've got a diagram for you guys. I just made a quick one. Does anyone want to see a diagram showing most common verbs?
Yeah.
Yes, please.
Absolutely.
Yes.
You can download this from the website. So I'll make sure today I'll put it on the video for you guys. Okay, so here is the diagram. I think it's here. And yes, I'm using ChatGPT, so I will double check this later, but it looks correct. It looks right. Okay, so ditransitive are usually things like give, send, show, offer, prescribe, explain, write, refer, order, grant. Okay, we can put also suggests. Okay, does anyone have any questions here? You can review this before tomorrow's class. Suggests. Here we're saying, this is interesting. Look, here it said, can everyone see explain?
Yeah.
Yes.
Now,
Explain.
to put a star here because I would say it's very informal, right? Informal with indirect. So this gets a little bit tricky with some of these things. But I will give you this diagram to study on the website, okay? All right, so I want to do one last thing with you guys, and then tomorrow we'll continue and we'll review this, okay? Don't worry, we'll always review. Can I show you one more set of case notes?
Yes,
Yes,
please.
sir.
Yeah, okay, so we're going to go to, let's try this one. So who's the patient, guys?
Mr. Harris.
Mr. Harris.
Okay. And how old is he, everyone?
70.
Yes.
Now look at this blood pressure measured. Who did that, Kadriye? Who measured the blood pressure?
Healthcare professionals
Healthcare
like nurse.
profession, yeah.
Healthcare professional measured the blood pressure. For, okay. So, Andrea, can you say hello, Andrea?
Hello.
So, where's my subject and my verb?
Um,
I'm sure.
Professional is the subject, the verb it's measured.
Good. And then the others, is there one object or two objects?
It's one, blood pressure.
Are you sure there's only one?
In Mr. Jones, yeah.
So, everyone in the chat, quickly write me a sentence starting with blood pressure, the direct object. Quickly in the chat. You should all be able to do this now quickly. So the blood pressure was, write it in the chat quickly. And then, so number one, write a sentence starting with direct object. Number two, ask yourself, does measured allow indirect object? Does it sound right to you? Or does it sound strange? If you're watching a lot of TV and listening to lots of podcasts, you should get a sense of if something sounds correct or not, okay? So anyway, let me just quick check this. Kadriye, Esma, correct. Aisha, correct. Shakeen, correct. Shakeen, no, don't say by the. Shakeen, we don't need to say by the, okay? Blood pressure was measured for Mr. Yeah. Ina, yours is the best one because she's putting in both. Yeah, nice, Ina. Esma. Nice, Esma. Esma's saying Mr. Jones's blood pressure. That's a clever way to do it. But okay, so everyone can do this one. Correct. Everyone, very nice. Last question. Can we start with Mr. Jones or not? Does it sound right?
Yeah, we can start.
Not.
Right? Look, if I say Mr. Jones was measured, why does that sound wrong?
Because we don't want to measure Mr. Jones.
Mr. Jones didn't measure his blood pressure.
This verb has to kind of make sense for both objects. It's really simple. That verb has to ask yourself, measure Mr. Jones. Is that what is happening? No, we're only measuring blood pressure.
Yeah.
But if I say I gave Mr. Jones a book, or I can say I gave a book to Mr. Jones. Does gave, can I say I gave Mr. Jones?
No.
The book was, actually you can. So we're going to talk about this more tomorrow. Okay, we'll talk about it more. So I'll finish now. Thank you very much, guys. We'll review tomorrow and do more practice. Thank you.
Thank you, Alan.
My pleasure, guys. Okay. What?
Thank you.
You are welcome. Wait here.
Thanks, Alan.
Gonna start.
Thank you.
You are welcome.
Thank you for the class.
Thank you.
Just wait here and we'll start the